Your healthcare team is here to support you as you transition from hospital to home. Many patients are discharged home on post-op day 1. If you're discharged later, the process is the same. You'll be given a discharge package before you leave the hospital. The package includes your prescriptions, a discharge summary, important dietary information, and contact numbers. Let's talk about the prescriptions you'll receive. There will be a prescription for pain medication, an antacid to relieve indigestion, upset stomach, and heartburn, a laxative to help prevent constipation. Plan to get your prescription filled when you leave the hospital, and take the prescribed pain medication only if you need to. If your pain is mild, you can take acetaminophen, such as Tylenol Extra Strength. You won't need to take blood thinners once you go home, unless you were taking them before your surgery.